This is Chapter 18, Module 6, Organs with Secondary Endocrine Functions. The learning objective of this module is 1. Describe the functions of the hormones produced by the kidneys, heart, thymus, testes, and ovaries. Many organs of other body systems have secondary functions as endocrine organs. The intestines with primary functions in the digestive system, the kidneys with primary functions in the urinary system, the heart with primary functions in the cardiovascular system, the thymus with primary functions in the lymphatic and immune system, and gonads with primary functions in the reproductive system all have secondary functions as endocrine organs. The intestines produce hormones important to coordinate the digestive activities. We will discuss more about these when we discuss the digestive system. The kidney's major function is to filter the blood and produce urine. The kidneys also have a secondary role in the endocrine system. They produce calcitriol and erythropoietin, or EPO, as well as the enzyme renin. We have already discussed calcitriol and its role in calcium homeostasis. Remember that calcitriol is released from the kidneys in response to the parathyroid hormone release, and it targets the small intestine to increase the absorption of calcium from foods ingested. EPO and renin are released in response to falling blood pressure and blood volume. In other words, when blood pressure and volume fall in response to blood loss, erythropoietin is released from the kidney and will target red bone marrow to stimulate the increased production of red blood cells. Increased red blood cells means increased blood volume, and that translates to increased blood pressure. Renin is an enzyme that is released by the kidney in response to falling blood pressure and blood volume. Renin hydrolyzes angiotensinogen, which is released from the liver, into angiotensin II. Angiotensin II is a peptide that constricts blood vessels. The constriction of blood vessels causes increased blood pressure. Angiotensin II also acts on the adrenal cortex and causes the release of aldosterone. Aldosterone, as we know, increases the reabsorption of sodium in the kidneys. When sodium is reabsorbed, water follows. Water reabsorption causes increased blood volume and thus increased blood pressure. In addition, angiotensin II stimulates the release of ADH from the posterior lobe of the pituitary. ADH stimulates water reabsorption in the kidney, thereby increasing blood volume and ultimately blood pressure. Renin also acts on the central nervous system, increasing thirst, and thus increasing the amount of water intake and ultimately increasing the volume of blood in the body. The heart's primary function is in the cardiovascular system, but it also has secondary roles in the endocrine system as well. The heart produces a hormone called natriuretic peptide, or ANP. When blood volume becomes excessive, ANP will cause the kidneys to release more fluid in the urine to reduce blood volume. The action of ANP then opposes the action of angiotensin II. In other words, the action of ANP opposes the actions of both ADH and aldosterone. The thymus is a gland that sits above the heart. The thymus produces hormones that help develop and maintain normal immune defenses. We will talk more about the thymus when we discuss the lymphatic system and the immune system. The gonads are the testes in the male and the ovaries in the female. The testes produce androgens in their interstitial cells. Testosterone is the most important androgen. Another hormone called inhibin is released in the nurse cells of the testes. Inhibin helps in differentiation of sperm cells as well as their physical maturation. The ovaries produce estrogens. The principal estrogen is estradiol. After ovulation, when the oocyte is released from the ovary, the follicle cells degenerate and begin to produce both estrogens and progestins. The principal progestin is progesterone. The reproductive organs are important hormones for growth. Androgens in the males and estrogens in the females stimulate cell growth and differentiation in many tissues in the body. These hormones also produce gender-related differences, including skeletal proportions and secondary sex characteristics. We will discuss more of these differences in the modules on the reproductive system. Adipose tissue produces a hormone called leptin. This hormone is useful as a feedback control for appetite. It also helps to control normal levels of gonadotropin-releasing hormone. This ends Chapter 18, Module 6, Organs with Secondary Endocrine Functions.